All right, let's talk about the joint motion. We have so far talked about the joint structure and the function, and now we'll discuss the joint motion and different aspects of joint motion from the very biomechanical standpoint. And we'll see that what are some of the important aspects of joint motion from the biomechanical perspective. Before I talk about the joint motion, let's talk about this term called osteokinematics. So you guys know about osteokinematics so far from what we have learned, okay? Because osteokinematics are nothing but the motion of the of just the gross motions that we see, where our bones are moving. Osteo just means bone. Osteo just means bone, and kinematics, you guys know, is the motion. So wherever our long levers that are basically our bones moving, whenever they're moving, that's called osteokinematic motion. Now, the examples of that are just our normal motions that we have learned so far: flexion, extension, abduction, abduction, rotation, cervical head motion. So all of that, all of this is your osteokinematic motion. Now the important thing to realize here is that when you are having osteokinematic motion, there is also a motion happening inside your joint, okay, that you cannot see. Osteokinematic is the motion that you can observe, okay, and that you can actually see that motion happening. But there is another motion that happening inside the joint which you cannot see, and that is your arthokinematic motion here. Artho just means joint. Kinematics, as you guys know by now, is just motion. Okay, there are three types of arthokinematic motion. Okay, I'll describe all of them. Like, for example, first one is rolling, then we have gliding, and then the third one is spinning motion. Most of the times, all three of these motions are happening together. Okay, let's see what is rolling motion. Like you can see here in this one, when the knee is going into the flexion motion, the rolling is happening there, and the rolling is basically a motion where it's like your tire moving. So basically, what is happening that you're having different points of contact in the entire motion. Okay, so basically one point of contact gets into another point of contact throughout the motion, like the tire rolls on the ground. So that's basically your rolling motion. And the important thing about the rolling motion is that this motion is always in the same direction as your bone is moving. Like, osteokinematic motion and the rolling motion inside the joint would always be in the same direction. Okay, and again I repeat that when multiple points along one rotating articular surface contact multiple points on another articular surface, so the points of contact keep on changing. Multiple points contact the multiple points in the other articular surface. Okay, so let's summarize this. There are two salient features of the rolling motion inside the joint. One is that it's following the osteokinematic motion. Okay, if the flexion is happening here, and the flexion is basically a motion that where two joint surfaces are coming close to each other, the same thing is happening, that rolling motion is happening in the same direction as the flexion. So this is osteokinematic, osteo, and this is rolling. Okay, both are happening in the same direction. So that is an important aspect of this. Now the second one we talk about is the sliding motion. Sliding is also called gliding motion. Okay, both of them are the same words, and they are used interchangeably. It's like a motion where you can see that your car is sliding over a snow. So basically, a single point on one articular surface contacts multiple points on another articular surface. So like this car, the tires are the single point they're going to stay the same because it's sliding, and then it's going to come in contact with the multiple other points on another articular surface. Okay, another important thing about the gliding motion is that the direction of the gliding motion basically depends upon the surface that is moving. Okay, now that's a very important point here, because if the sliding or the gliding motion is because of the convex surface, then the osteokinematic and the gliding motion would be opposite to each other. However, if the articular surface is concave surface, then both of these would be in the same direction. Now, I would not want you guys to worry about this. We are going to go over the concave convex rule in this content, and we would go over this in detail, and you would be able to understand that. Okay, so don't worry about that right now. Okay, the third one is the spinning motion. The spinning motion is basically a type of motion um, where a single point on one articular surface rotates on a single point on another articular surface. The example of this is this coin spinning. These two surfaces would stay the same. They would just keep on spinning on each other. Okay, this surface and this surface, both of them are going to be the same here. So the example of that is your proximal radial ulnar joint, where your radial head is rotating inside the annular ligament here that you can see, and this is basically your spinning motion. Now let's talk about the concave convex rule. And in concave convex rule, we basically talk about the gliding motion here that I just discussed with you guys, and then we'll learn how gliding motion is happening alongside the osteokinematic motion. Okay, let's talk about this here. I'll try to explain it in a very easy way. Look at this surface. This is your convex surface. Okay, this is your concave surface. If the convex surface is moving upwards, okay, then what is happening is that the gliding motion is downwards. Then your convex surface is going to glide downwards. If the bone that is convex, that has a convex articular surface, is going to move upward, the convex surface would move downward. So there is an opposite relationship. Convex surface, opposite relationship. And I'll tell you in all honesty, that's the only thing you need to know, and you would be able to figure out everything else. The example of that is shoulder abduction. In the shoulder abduction, when your head of the humerus is moving upwards, like it's rolling upwards, it's going upwards, then the glide is in the inferior direction. Okay, so that is a very cardinal example of your concave convex rule. Okay, now the concave rule. If in the concave rule, what is happening that if the bone is moving upwards, okay, if the osteokinematic motion is upwards, the glide is also upwards. Okay, so both of them are in the same direction. Okay, so that is very easy to understand, and I'll give you very easy cheat sheets for that, but I want you guys to discuss this in the comment section. I want you guys to discuss which major from upper limb and lower limb, tell me which joints have convex rule in open chain and which joints have concave rule in open chain. So I want you guys to discuss that, and then maybe in one of the next videos I would be able to explain you the concave convex rule in each joint. It's a very easy formula I'll give you. Okay, all right, I hope the concave convex rule is clear to you now, that glide is opposite when the moving surface is convex. Okay, so if the convex surface, if the osteokinematic motion is going upward, the glide would be downward. The glide is in the same direction if the moving surface is concave. Okay, if the concave surface that is moving goes upward, the glide is also going to be upwards. That's the summary of your concave convex rule. Let's talk about the end field real quick. End field is just the field that an examiner feels at the end of very range of motion. Okay, so at the end of the range of motion, your examiner or the assessor or a physical therapist who is assessing the motion would feel this. And the end field can be of three physiological. There can be a lot of types of end fields, but for simplicity, we'll just stick to the three important physiological end fields. We are not talking about the pathological end fields here yet. So you have a soft end field, you have a firm end field, and then you also have a hard end field. Okay. This basically soft end field is when your two soft tissues are approximating each other. Like, for example, right now I will give you a task to do elbow flexion, and you'll see that, that would be your soft end field. Similarly, knee flexion is an soft end field. Your firm end field is when your ligaments are restrained. That's your knee extension. Okay, that's your firm end field, and your hard end field is bony to bony limitation. When two bones are approximating each other, that's your elbow extension, and that's your hard end field. Okay, there is another end field called empty end field. okay, which basically is no end feel. Examiner does not feel anything. And this is a pathological end feel when the patient is not able to complete the motion. So there is no end feel because you do not go to the end range of motion. And this is a pathological end feel, okay? We are going to go a little over 10 minutes for this one because we covered a lot of different concepts in this joint motion, okay? And then the last thing we talk about here is last couple of things we talk about here is joint mechanics. You have the open pack and the closed pack position in joint mechanics. So the open pack position is the one where the ligaments are lax. That's the easiest definition for this. Okay, the ligaments are lax. Here, for example, these ACL and PCL, they are laxed. They are relaxed. Okay, just I would explain it in a more easy way. They are relaxed. Okay, like for example, 25 degrees of knee flexion is your open pack position or the loose pack position. Okay, you can call it loose pack, you can call it open pack. The significance of this position is that that the ligaments are laxed or relaxed in this position, and the examiner or a therapist would use this position to do the joint mobilization. Okay, since you're working with a patient and the patient is possibly hypermobile, that's why you're working with them, so you bring them into the most relaxed position where you can apply the joint mobilization. The closed pack position is the one where the ligaments are taut or they are tight. They are taut ligaments here. Okay, so full knee extension, okay, is your closed back position. Okay, this position has significance also. Clinical implications are that this position is used to test the stability and used to do the stability exercises. Okay, all right. And this is just a clinical example that all loose back positions are used for the Tai Chi practice. Capsular pattern is our last thing here today. Okay, in the capsular pattern, it's just the limitation. Capsular pattern in the simplest form is the limitations in the joint motion in a specific order. Okay, if they're in a specific order, then we give them the name capsular pattern. Okay, capsular pattern is when this is the normal capsule, normal shoulder capsule. Okay, and this is your inflamed capsule here. You can see that it's inflamed. Okay, this inflamed capsule would result in joint motion restriction. Okay, and that would be in a specific order. Different books have different capsular patterns for shoulder, but most commonly you see is external rotation, abduction, and then you have flexion or internal rotation. Okay, now why I have written these in a specific pattern. Okay, the pattern is that external rotation would be restricted first, followed by abduction, followed by internal rotation and flexion. Okay, so this is your capsular pattern. If a patient comes to you and they have a restriction in external rotation, abduction, and internal rotation, then their restriction is in a specific capsular pattern. This basically helps clinician to understand the reason of the restriction. If the restriction is a specific order, in this order, then there is a problem in the joint capsule. So clinician does not have to worry about a muscle tightness or some ligamentous problem, or something else. The problem is not muscle tightness. Then they would focus on the joint, and then maybe they would follow up with an imaging of an MR imaging or some other imaging, to follow up or to see what is happening with the joint capsule. Okay, I went over 10 minutes. Sorry about that, but we covered a lot of stuff in a very precise way. Leave your comments here, discuss this, and let's get this going. Thank you very much.